In the news lately, circumcision. It's always discussed. Sometimes it should, sometimes it shouldn't. What is your opinion of circumcision? We're not talking ritual. We're talking if a baby is born today, should you circumcise your kid or shouldn't you circumcise your kid?
Well, we know there are very cultural differences in circumcision, but if you disregard the cultural cultural issues, the American Academy of Pediatrics does state there are some advantages to circumcision, especially in the young, in the neonatal period. There is a slightly decreased incidence of infections after circumcision in the first 1 or 2 months of life. After that, if proper preputial care is performed, there is no advantage or disadvantage with circumcision.
If you choose to not circumcise, is there any extra care you should take to that penis so you don't get infection or get some kind of problem?
Yes, we do teach proper preputial care. However, it must be stressed that the foreskin does not need to fully be retractable until the age of 3 or 4. But proper hygiene care can prevent possible balanitis prior to that time.
So the parents roll back the area and keep it clean without, causing undue pressure?
Yes, they should, during the bath, to pull the skin back as far as it could go with minimal or moderate pressure, but try not to pull the skin back when there's resistance. Keep it clean, and over many years the skin will retract.
There's some indication that the incidence of AIDS is a little bit lower in a circumcised male. Is that true or not true?
There's recent research and recent articles that came out of the Asian and African studies. That hasn't been proven yet. They're early studies, and only time will tell at this point.
So if you take good care of the area and make sure you don't get any kind of residual or any kind of infection in that area, you probably could go either way, and it's really based on what you and your pediatrician discussed together. Is that true?
Yes, it's a personal preference. We explain to the family what the benefits and risks of the procedure are. It can be done during the neonatal period up to 1 month of age in the office using a lidocaine or numbing cream. After a month of age, then it would require anesthesia, and we usually would recommend after 6 months when the anesthesia risk is minimal.